Assalamu alaikum. We are starting our today's session. We have male patient, Mr. Sam, 55 years, with complaint of short of breath and abdominal discomfort. We'll share the timer, then we can start. Okay, start. Hello there.
Okay. Hello.
Yeah, this is Dr. Mukhtar, the doctor in the clinic today. You must be Mr. Sam.
Yes, I am Mr. Sam.
You are 55 years.
Yes.
Can you tell me more about your complaint?
Actually, in the last few weeks, I feel short of breath and have fatigue.
Okay, I'm sorry to hear that, Mr. Sam. Can you tell me more about that? Any previous attacks of this short of breath?
Yes, it start gradually, as I said, for the last few weeks, and it is interrupt me to do my job and my hobby as well.
Okay, before this attack, did you suffer this short of breath as well, or this first time ever?
No, I have shortness of breath since a few years ago.
Okay, and you notice it's worsening day after day.
Yes, it is worsening in the last few weeks.
Okay,
I
along with
cannot
this
catch
short,
my breath. Yes.
yeah, yeah. Is it there is particular time for this? Is there any
Mm,
particular time?
I feel it is more severe uh, in the late of night or in the beginning of the morning, in the early morning.
Okay. And you notice you're awaking from sleep, catching or just catching the air, right?
Yes, yes, yes.
How many pillows you are
I wake.
using? Yeah.
Yes, actually, I wake from the sleep, feel short of breath. I hurried up to the windows. I opened the windows to catch my breath. And yes, I sleep on the 2 to 3 pillows sometimes.
Okay. Along with this, did you notice some leg swelling
Of course, I have a leg swelling. Yes,
in both legs?
yes, on both legs.
Any swelling around your eyes? You notice?
No,
Okay. Apart from this, you have any cough,
no,
any dyspnea or short of breath while walking or doing effort?
yes, of course, doctor. I have shortness of breath in the third step in my stairs. And in the last
Okay.
days I cannot reach the door of the house.
Any chest pain with this?
At the moment there is no chest pain.
Okay. Did you cough up? Uh, did you cough blood before?
No.
Okay. And do you feel your heart beats or aware of your heartbeats?
Yes, I sometimes feel palpitation.
Okay. Anyone told you that you are paler than before?
What?
You are paler. You look paler.
Sorry?
You look paler than before. Anyone
No,
told
no,
you that you look paler?
no,
Okay.
no.
I hear you have also some tummy discomfort. Can you tell me more about that? Is it the same duration?
Yes, actually the 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 right side of the my abdomen is being some discomfort in my abdomen.
Okay. Along with this, you feel any sickness? You are feeling sick,
No, no,
throwing up,
no,
throwing up of blood.
no.
Okay, how's your bowel habit? Can you tell me more? Is it
I
hard
have
or
normal bowel
loose?
habit.
Okay,
There is no
and
issues with my bowel habit.
okay, how's your appetite, Mr. Sam?
Actually, my appetite in the last uh, few weeks, as I said, is dropping, is worsening.
And your weight, Mr. Sam?
Actually, I feel I gained some weight.
Okay, and any high body temperature with this?
No,
Any lumps or bumps in your body?
no,
Any night sweats?
no.
Okay, you have diagnosed before with any long-standing disease?
Yes, I have diabetes mellitus type 2, and I have hypertension for the last 15 years. Also, I have what's called heart failure.
What you are taking indication for those?
I take many medications. It's
Can,
a very long list of medication. If you ask
okay,
me, I will answer you.
okay, for diabetes, are you taking insulin or some medication tablet?
No, I put the doctors put me in the insulin for short period, and I am returned to the oral medication.
Are you compliant with this medication?
Actually, yes.
How is your blood sugar for 3 months reading?
My blood sugar in the last months is worsening, doctor.
Can you give me a reading? You remember?
Yes, in the morning when I was fasting, it sometime reach 400 milligram per deciliter.
Okay, and you hear about hemoglobin A1C, the reading for 3 months. How much is it?
I think the last record was around 9.
Okay, for diabetes, what medication
Mm.
you're taking?
I think
Sorry, for
metformin.
hypertension, for high blood sugar,
Yes. Mm.
for
I
high blood pressure. Sorry, high blood pressure. What are
yes
you taking?
yes I taking lisinopril, and I take amlodipine, uh, and I take diuretics.
And how's your blood pressure recently?
It's well controlled. Well
For
controlled.
the yeah, for the heart failure, what medication you're taking?
I take diuretics for the heart failure, and take as I said, lisinopril and Concor, 5 milligram per day.
Okay. Uh, any surgery before?
Yes, I have surgery before. Actually,
Can
I
you,
have surgery before. Actually, I have surgery before 4 years in my heart.
and did you insert some stent in your heart, blood channel?
No, no,
May I know the
it is
surgery?
not. Yes, I think it is was surgery for valve issues like that.
Okay. Are you taking any blood thinner?
Yes,
May I know the
I
name?
take I take aspirin, I take Plavix. Actually, I'm sorry, I take aspirin and I take warfarin.
Okay. Uh, so, Mr. Sam, you have any problem with your vision?
No,
Any pins and needles in your hand or your feet?
yes. Sometimes I feel a tingling sensation in my hands or my feet. I thought
You have
it was related to the my bad records of my diabetic.
okay. You have any pain while walking distance in your leg?
No,
Any heart attack?
heart attack. I didn't يعني remember if I had heart attack.
Okay. Any stroke or mini stroke?
No.
Any weather preferences?
What?
Do you prefer any weather?
I don't understand you.
You are tolerating the cold weather and hot weather without any problem.
No, no. I don't have issues with that.
Okay, and your water work is okay? Any change?
It is normal.
Normal. No frothiness in the urine.
No, no,
Okay, any skin rash?
no,
Any joint pain?
no.
You have any problem with your intimacy? Sorry for this question. Your
Uh,
relationships. You have any difficulty?
yes, actually, I thought it is related to the my diabetic.
Okay. Any family history, same problem.
No,
Did you notice that your skin like darker or tanned?
no,
Okay. Any travel recently?
no. You have 4 minutes.
Yeah. Okay. Can I examine you?
Yes,
By general look, how the patient he's underweight, overweight.
the patient is sitting in 45 degree with a sign of with a short respiratory discomfort.
Okay. Can I check the vitals? Blood pressure, blood sugar, temperature, and pulse.
Blood pressure, you don't need to check. The pulse rate was regular. The
Okay.
volume was a good volume.
Okay. Any
The,
arrhythmia?
and the rhythm is normal, regular.
Normal. Okay. Any
Yes.
congested wrist, JVP?
The JVB is one finger below the air loop.
Okay. And let's examine the chest, inspection, palpation.
Okay. By
Any,
inspection,
there
yes,
is a scar.
there is a scar in the midline of the chest.
Okay. Any click sound heard, audible.
There is no obviously click sound.
Okay. So any murmur all over the heart valves.
There is a systolic murmur in the mitral area, radiate to the axillary area.
Okay. Any loud P2, parasternal heave,
Yes, there is parasternal heave.
parasternal heave, and loud P2.
You didn't appreciate if there is loud B2 or not.
Okay. I will sculptate the chest from the back. Any crackles?
Yes, there is bibasal crackles.
Okay. Now I will examine the face. Any jaundice, pallor.
No jaundice, no pallor.
May I know your job, Mr. Sam?
Actually, I am a teacher.
Do you smoke? Do you drink alcohol?
Yes, I am heavy smoker and I didn't drink alcohol.
Okay,
I don't
smoking
drink
is
alcohol. Yes.
okay. Smoking is harmful for your health. I would advise you to stop it. If
Thank
you
you.
want, you can refer. Okay. Can I examine the abdomen? Inspection. Any scar?
There is no scar in the abdomen.
So the any caput medusa, spider nevi, any chronic liver
No,
disease features? Any
no.
ascites? No ascites?
You can make a technique for ascites.
Yeah, shifting dullness.
There is a positive shifting dullness.
Okay. Any sorry, there is shifting dullness. Okay. Any stria in the abdomen?
There is no stripe.
No stria. Okay. And leg swelling. Is it pitting edema?
There is pitting edema bilateral up to the below the knee.
Okay. May I know your concern, Mr. Sam?
Actually, my concern why the my condition worsening. The doctors in the last 3 and 4 years, they assure me that I will return to the a normal life with normal activities. But in the last few weeks, I have these problems. Why these problems occur to me?
Okay. While examining, I'm addressing his concern. Any signs of infective endocarditis in
There
the
is no
hands,
Janeway lesion.
generally?
There is no Janeway lesion. There is no Osler node, and there is no clubbing, and there is no cyanosis. And the
Okay.
temperature
So,
is normal.
okay, Mr. Sam, I appreciate your concern. You have a condition complicated due to your uncontrolled diabetes and blood pressure.
Time finish. Time finish, but
Yes.
okay, continue.
Okay. So, to know what's ongoing, we have to admit you and to run some investigation, some scan and image to confirm your diagnosis. Uh, is that okay for you?
Okay,
Okay. So the time is gone. Let's go to the examiner time.
okay.
Okay. So we have Mr. Sam. He's 55 years. Came with complaint of short of breath and abdominal discomfort for the last few weeks, and there was previous attacks of the same complaint. Uh, from the history, patient looks he has some loss of appetite and gaining weight. There is
Yes.
no constitutional symptoms apart from this. No family history of his condition, and he's uncontrolled diabetic patient. His hemoglobin A1C is 9, and his fasting blood sugar is high. Along with this, he is smoker, heavy smoker,
Mhm.
and yeah, his blood pressure is controlled. On the examination, there is congested neck veins and fine crackles on the back by basal fine crackles
Mhm.
and pitting edema up to the knees.
Yes.
There is also shifting dullness ongoing with chronic liver disease. So my top of differential diagnosis it's complicated heart failure, acute decompensated, or acute on top of chronic, acute on top of chronic heart failure, and
Mhm.
some other complication due to uncontrolled diabetes. Like
Okay,
I didn't examine for, but he mentioned pins and needles, so could be neuropathy.
okay. What is your differential diagnosis?
So I put differential diagnosis. This patient hemochromatosis and yeah, complicated by diabetes and the heart disease due to diabetes and coronary artery disease as a systemic complication, macrovascular complication of diabetes.
Yes.
Apart from this, I can put also heart failure, renal failure, or chronic kidney disease. However, no change of his water work or
Yes.
your
Yes.
yeah his
Yes.
renal system.
Okay. How does you link the shifting dullness with shortness of a breath?
Yeah, it's called cardio cardio or hepato-respiratory syndrome or pulmonary renal pulmonary hepatic hepatorenal.
Okay.
Yeah, I think
Uh,
yeah, hepatorenal syndrome.
yeah. Yes. What is your concern? What is your the major concern for these patients?
Yes, a major concern is to rule out infective endocarditis as he had history of mitral valve
Yes.
replacement. Yeah, I didn't
Yes.
mention it. Sorry, yeah, and there
Okay.
was also scar in the midline
Yes.
sternotomy scar.
Yes.
So it might be also a serious condition if he has infective endocarditis.
And second one, are you concerned about the fluid overload of the patient?
Yes, I mentioned he's in acute on top of chronic heart failure.
Yes. Yes. What is the type of the heart failure in these patients? What is called the
Congestive
type of
heart
this?
failure, yeah.
Yes, yes,
Congestive
yes,
heart failure.
excellent. Congested heart failure. So, do you have concern about the blood thinner medications for the patient? We didn't ask him about compliance with warfarin. Actually,
Yeah,
this patient has cut the using of his warfarin in the last few months.
yes,
Okay.
yeah.
Uh, okay. Please, can you give me what are the severity, the marker, or the sign of severity of mitral regurgitation?
Yeah, symptomatic patient mean that he has severe mitral regurg.
Number one. Number two.
The murmur, um, the murmur and the pulmonary pressure
Yes.
and pulmonary hypertension.
Yes. What about the a displaced apex beat? Actually, this patient has a displaced apex beat to the seventh intercostal space in the
Mm.
lateral to the midclavicular line. Okay. Can you give me the indication of surgery in mitral regurgitation?
Yes, any symptomatic patient, he might be indicated for replacement.
Okay.
Along with this, dilatation of the heart and the pressure around the valve
Yes.
and signs of infective endocarditis as well, and any thrombosis and pulmonary hypertension as a
Okay.
complication.
Okay. How
Or
would you?
reduced
How would
ejection
you?
fraction, yes, reduced ejection
Yes.
fraction.
Yes, actually, the indication for AMR, as you said, left ventricle dilatation, left ventricle in diastolic diameter more than 40 millimeter, and the ejection fraction below 60 and above
Yeah,
30, the symptomatic patients, and prosthetic valve with sign of valve failure. Okay, how would you like to investigate these patients?
yeah. Apart from baseline basic workup, CBC inflammatory marker very important here to rule out infective endocarditis, ESR, CRP, leukocytosis
Yes.
in the CBC. It's very important.
Mm.
Kidney function, rule out any affection of the
Cardiorenal.
kidney.
Yes.
Yeah, cardiorenal, exactly.
Mm.
And urine dipstick, urine analysis, urine culture, and blood in urine, protein in urine. Liver function test to rule out any affection of the liver, congestive liver, and liver function test, the direct and indirect bilirubin, total bilirubin, and I could add also full electrolyte coagulation profile, very important to check for his warfarin and the target of INR. This
Yes.
is for the labs. For the imaging, I could do echo, ECG and echo to rule out any arrhythmia and to check the ejection fraction and the cardiac function, either systolic or diastolic, and to rule out infective endocarditis. Uh, Apart from this, I can search for the complication like uh, diabetic complication, hemoglobin A1C, and other neurophysiological study for the neuropathy if the patient has signs
Okay.
of neuropathy.
Okay. Uh,
Chest X-ray
do you
and yeah, very
chest
important.
X-ray
Chest
and
X-ray.
ECG? Chest X-ray for lung congestion and ECG for any
Yeah,
palpitation or arrhythmia.
ultrasound abdomen for
Okay.
liver.
Okay. Up the ultrasound for the ascites. Okay.
Mm.
Do you want to check BT-TINR?
Yes, seat coagulation profile for checking for target INR in this patient. He should be in the target
Okay.
INR for the mitral valve replacement, 2 to 3.
Okay. How would How would you manage this patient?
Yeah, starting by multidisciplinary team approach, including the cardiologist and
Yes.
hematologist and
Mm.
pulmonologist, gastroenterologist, and social worker, GP, specialized nurse, diabetologist for the complication of diabetes, and neurologist if the patient has neuropathy. Along with
Yes.
this, I I will give some education counseling to the patient about his disease and the complication and safety netting about the complication of his diabetes and viral and possibility of infective endocarditis if he's not compliant to the warfarin anticoagulant. Pharmacological management starting in the acute state. If he's in acute state, I could start by ABC approach, airway and breathing circulation. If he's in failure, I can consider diuretics and I can add nitrate to reduce his blood pressure and consider BiPAP or CPAP if the patient in respiratory failure and hypoxic and affecting his respiration. For the other chronic management of this patient, warfarin should be resumed as soon as possible to prevent any complication from the mitral or thrombosis. And
Okay.
consider, yes, tight control, not tight control, control of his blood sugar by diabetology and multidisciplinary team approach.
What is about the surgical option in this patient?
Yeah, surgical option in this patient, if he is in failure, we can consider in the long term cardiac transplant as he is in failure.
Why cardiac transplant? Not why the mitral valve redo
Yeah, okay.
replacement.
Yeah.
Okay.
Yes.
Okay.
Re replacement,
Okay.
yes. You're right.
Okay. In the point of the cardiologist and cardiothoracic surgeon. Okay. Thank you. You were excellent, Dr. Basu.
Thank you, Dr. Hassanin. It's a very complicated case
Yes, it
and
is a
big,
complicated and a real
yeah.
case. Yes.
Yes, I know it's real, and they like this topic in patients, either Irish or
Yeah.
UK. But to
If you
catch
yes,
everything from everything, it's very difficult. The
yes,
complication of
but
diabetes,
you
the infective endocarditis, and hypertension,
yes.
ischemic
No,
heart
no, you
disease.
no,
Yeah,
you do well. Actually, you do well. You do very well.
thank
But
you.
I have some point. But I have some
Yes,
point.
sure. Give me.
Okay, okay. In the beginning, when you read the scenario, you may think the case is related to the nephrotic or maybe to the liver abdominal cause of dyspnea. You may think this dyspnea because of the ascites pushing the diaphragm upward and cause dyspnea. But in the consultation station, you can inspect the face or inspect the upper chest of the patient from the beginning. When you enter the room, you will see the scar. You will see the pitting edema, the swelling of the leg. Okay, when you see the scar, I think you may direct your thinking toward the cardiac cause of the abdominal discomfort. In any way,
Yes,
you analyze the shortness of breath. The shortness of breath was subacute on the background of the previous attack. There is worsening. There is palpitation. So, in heart, I directed you to
heart
the heart.
failure.
Okay,
Yeah,
heart. The palpitation and shortness of breath, there is heart. You analyze the shortness of breath, timing. I said the patient said the timing in the early morning. So you are near the diagnosis. You are catch the organ involved. The organ involved is heart.
yeah,
So when the organ involved is heart, now the case is semi easy or come more easy. The abdomen discomfort, you will see the abdominal distension. Actually, in the history, you didn't ask me about abdominal distension, but it's okay. You'll find it in the examination. So till now, the abdominal distension and the ascites actually in the examination reveal not to the chronic liver disease. This word may the examiner count it against you. Okay.
yeah. It's cardiac or heart failure. Yes,
Yeah. Yes. This enter in
congestive
the
heart
clinical.
failure.
Yes. This enter in the clinical judgment. So the examiner may become irritant because you finish your examination. There is a scar, there is a crackles, pitting edema, abdominal distension, shifting dullness. Okay, you didn't examine the liver, but it's okay. You actually, for me, you will pass this station. But when you examine the liver, there is pulsatile liver, there is hepatomegaly.
Yes.
So some candidates said the ascites, because of there is liver enlargement and ascites, there is a chronic liver disease. Actually not. There is a congestive heart failure with pulsatile liver and hepatic bruit with ascites. This all story, when we collect this all story, as you said, the professional diagnosis is congestive heart failure. But what is the cause of congestive heart failure?
Yeah, the valvular origin.
Yes. Okay, maybe it is valvular in origin, or maybe it is related to the DM,
ischemic
hypertension and ischemic heart disease.
Yes,
Okay.
you're right.
We have mitral regurgitation characteristic murmur. We have systolic murmur in the mitral area radiated to the axilla. You asked me in the examination, what about the click? Why I, as I candidate, why I didn't hear the click? Because when there is
one.
Yes, no, okay, it is maybe a bioprosthetic, a tissue valve, and maybe a metabolic. Yes, but in the metallic, why I didn't hear the click? The answer
because of
is
the regurg.
The answer is the valve is not crisp,
non-functioning.
What is not functioning, not a crisp valve. What it is called absent of the closure sound of the valve, which is sign of valve failure. So there is another question. Why I did assume that this scar is related to the valve, not to the cabbage, because I didn't found harvesting scar.
No,
I didn't find harvesting scar. There is no harvesting scar in the leg. There is no harvesting scar lima below the nipple in the chest. So I am deal with valvular heart disease or congenital heart disease or a structural heart disease surgery. But actually, in the consultation station, the job is easy. I am asking the patient, do you have valve surgery? He will say yes, because you see the scar. Okay. And overall, your performance is excellent. Regarding there is I told you there is an important question regarding warfarin compliance. Actually this patient put himself in this bad situation because he was not compliant with his medication, especially warfarin. So there is thrombosis and there is a valve failure, which is put him on the congestive heart failure state. So when the patient has valvular heart disease or even any cause, he used warfarin, you should ask him about the compliance of his warfarin, the book of his warfarin record, the follow-up of his INR. Okay, this is very important, and actually this is a critical point in this examination, like this scenario. The examiner he waiting you for this step. The examiner he will catch you on this.
You're right. That's
okay.
The most important medication in his list.
You didn't miss it. Actually, you ask about the blood thinner medication. At this point, account to you, not against you. But in the digging history about the warfarin complex, it is very important.
Yes, and the target INR as well.
Target, yes.
Yeah, the follow-up in the clinic.
Yes, I have one point. Actually, you ask very much about the diabetic state and the clinical consultation. You have no time, because when you examine these patients in the verbal way, not in the practical way, the time is short. But in the practical way, in the real way,
longer. Yeah, it's longer
longer.
in
So
the yeah.
when you ask about the diabetic control, last HbA1c, last, you will waste your time. That's my point regarding your what you are doing, and actually you're impressing me.
Thank you, Dr. Salim. I will answer the point of warfarin. When I ask
Yes.
you for about the blood thinner, you mentioned to me aspirin and Plavix. Then you said warfarin. That's why I missed to ask about warfarin. Yeah, it was like
Distraction.
yeah,
Distraction
you
is
distracted me. Yeah, then yeah, I
distraction is
jumped because you know when you put something in your mind
uh,
and you are about to
uh,
ask the next question, whatever you will hear,
um,
you will ignore. Because I put my
yes,
in
yes.
my mind I will ask about something, and you told me it was aspirin. Then you add warfarin, then I ask you
I know
another
this
question. So
situation. I know this situation. You so I
yeah,
put you on the track.
yeah, yeah. Anyway, it's a nice case. I like the complicated cases because you'll be under pressure, and in the exam,
Yes,
it will be maybe it will be easier than this scenario, and maybe you'll have a complicated scenario. Anyway, to be
yes,
trained on a complicated case in the practice days, much better than facing it in the first time in the exam. You will be in
yes.
trouble. You will be distracted between diseases and medications and thinking here and there. For me, like what I did, I thought about the hemochromatosis, and it's not related to hemochromatosis at all because
Not related.
there
Okay,
was liver
okay.
disease.
No,
Yeah,
okay.
so it's just yeah, cardiac and cardio, not cardiopulmonary. What's called cardio, but nothing is called cardio, but it's congestive heart failure.
Congestive
So
heart
it's
failure. Congested.
yeah, congestive heart
Congested.
failure. Yeah, by the
Congested.
way,
Yes.
yeah,
Uh,
by the way, the liver will be tender in the examination, and be cautious with that. Ask the patient before touching his abdomen to check for the
uh-huh.
congestive neck veins and to
Uh-huh.
palpate his liver. It will be
Uh,
tender. This is one
yes,
of the
yes, yes,
causes
yes,
of tender liver. Yes, you're right.
yes,
And
yes.
again, it's nice case. Yeah, as Dr. Ahmed said, it's rich case of data and finding. Yeah, I like this kind of cases. Better to face them in the training and practice days. Thank you, Dr. Hassanin.
Thank you.
Yeah,
Actually, I have a last point. Uh,
yeah,
I think this case it is not difficult. It is easy. Why it is easy?
yeah,
It is easy because we should not have a philosophy. We should not have we should not complicate the case on us because I have scar, I have ascites, spitting edema,
yeah,
crackles.
you're right.
So
Yes, you're right.
why I put liver? Why I put liver? It is a congested heart
Yeah,
failure.
congestive
So
here.
yeah, okay, it is easy case in the but the thing is that I appreciate you actually. You have work as a step by step.
Yeah,
Even you, if even you not catch the diagnosis, but you catch the diagnosis. I said even you don't catch the diagnosis, uh, you you cover all the story. You analyze the
yeah,
symptoms. You ask about concern. You ask about the drug history. You ask about surgery. You ask about social history. Uh, in this performance, I think you will pass. Apart from the chronic liver disease, hemochromatosis, I think the examiner he will forget. يعني
yeah.
forgiving this to you if you put the congestive heart failure in the first differential. And thank you.
Yes, you're right. Yes. This is the lesson from this case. Try even you have a lot of disease to put good differential and might be your differential including the disease. I don't
Yes,
know which
yes,
yeah which order I put for the heart failure acute coronary failure. I guess it was the second differential anyway, but still, as you said, in in the differential, and I might take the mark from the differential and the diagnosis, the possible diagnosis in this case. This is the lesson. Don't be
yes,
distracted and don't overthink. I was overthinking what's the relation between liver and the breathing. That's why I put the hemochromatosis, diabetes. Then I thought about the heart, then hypertension, ischemic heart disease. This is the way how to think with the comorbidity, multi-comorbidity. That's why it's a nice case. I like this case actually. Thanks, Dr. Hassanin. And
Thank you.
I hope all catch the case, the diagnosis, and the differential, and they learn from this case as well. Any question, any comment? I see in the chat only one comment. So the case was clear. Maybe I am the one overthinking. Okay. Any question before moving to the second scenario? Yeah, the second lesson here also, any patient with valvular disease, don't forget to do or to add infective endocarditis to the case as differential and to the case on examination and rolling out it. Okay, differential
Yes,
diagnosis list, please. Yes,
yes.
congestive heart failure.
The differential
Yes, Dr.
diagnosis,
Hassan.
the differential diagnosis in this case, the number one is congestive heart failure. It is a congestive heart failure related to a valvular heart disease and ischemic heart disease due to the past medical history of DM and hypertension. And number three, maybe it's due to infective endocarditis. Even, but the absence of the fever and the absence, the stigmata of infective endocarditis against this differential. Actually, we don't have a lot of differential in this case because it is direct. It is one-way direction. If you put chronic liver disease due to congestive heart failure, it's okay. Why not? We know one of the second most causes of chronic liver disease is vascular. The number one is viral and non-alcoholic fatty liver disease and NASH alcohol, and the third most common is vascular. Vascular, it's mean the heart failure. So you can put the chronic liver disease in the bottom of the differential. It is not wrong, but it's not the first differential because you have scar in the midline of the chest, you have mitral regurgitation, you have bilateral pitting edema, you have bibasal crackles, you have basal sacral edema. I think if the candidate don't mention the congestive heart failure or put it in the third or second differential, it not will
Yes.
pass this station.
Yes.
Because
I
we
agree.
have because we don't have a lot of differential. If I wrong, correct me.
We can put also hepatopulmonary because the main complaint is short of breath and hepatic
Yes, I said
discomfort, or sorry, abdomen
yes.
discomfort. So
Yes, we can.
hepatopulmonary.
Yes, as I said, we can put the chronic liver disease because of
Yes.
congestive heart failure.
Yeah.
Because the vascular cause of the chronic liver disease, the third most common cause is vascular. It is congestive heart failure and Buchiari syndrome. We can put it, but I think the examiner, he will ask you what is the causes of congestive heart failure in this case. Okay, you can say infective endocarditis, but not in the first differential. The first is valvular heart disease, mitral valve incompetence, because there is absence of the closure sound, and there is a sign of valve failure. This is number one, valvular heart disease. Number two, it is maybe due to ischemic heart disease. The patient has acute decompensation due to his DM and hypertension. And number three, which is unlikely in this case, it is infective endocarditis. The examiner may ask you how you link the abdominal distension and the shifting dullness in this patient. You can say because of fluid overload and anasarche, or maybe due to chronic, yes, or maybe due to chronic liver disease, due to even also congestive heart failure.
Yes, I agree with you. But Kayari will be more acute than this patient's presentation.
Yes, more
So
acute and more painful. Yes.
yeah, and more painful all over. Yes. So I think it's not matching the case. Okay. Thank you, Dr. Hassanin. Thanks all. Stuck mitral valve. I guess it's different. The stuck mitral valve is different. Stuck when
What is
there
stuck
is
mitral valve?
thrombus. Yeah, there is thrombus over the mitral valve.
Okay. The examiner may ask you, what do
Yeah,
you
could
think
be
the
yes.
cause? Yes, what do you think the cause of the valve failure? The cause is obvious because the patient he didn't compliance with his warfarin, so there is maybe thrombus formation in the valve and causing a valve failure.
Yes. Okay. So the failure of mitral valve either due to non-compliance to the medication, the anticoagulant,
Yes.
or infective endocarditis, or
Or
from the
infective
heart
endocarditis.
yeah, or the heart
Yes.
itself, ischemic cardiomyopathy and the dilatation of the heart and the valve getting wide or bigger. That's why the valve is not functioning. This is one of the complications. 3K word stop warfarin, median sternotomy, no click. 3K
Yes.
stop. Yeah, this is the
Very good.
cause of stuck, yes. Or the cause of the case, you mean. No click,
Yes.
stop
Three
warfarin is not
keywords.
median
Yes.
sternotomy.
Yes. The
Yeah,
diagnosis
yeah,
actually, yes. The diagnosis in this three elements. In the history, stop warfarin, scar in the beginning on the station or in the inspection, and no click. So there is a valve failure. Valve failure causes congestive heart failure. Congestive heart failure give me picture of ascites, shortness of breath, hepatomegaly, bibasal keratosis, lower leg edema, mitral regurgitation. And there is a question, what is the cause of parasternal heave in this patient? The cause of parasternal heave in this patient, because this is a real patient in the my wards in the hospital, because of a pulmonary hypertension.
valvular.
The bar,
Yeah.
yes, valvular heart. So I think you discussed the pulmonary hypertension yesterday. If if
It's
I
type 2.
remember exactly,
Yeah,
yes, it is
yeah, it's
it is
type
type
2.
two. It is
Yeah,
type two, a category of pulmonary hypertension due to left-sided
left
valvular
side heart failure.
cause,
Yes, well, yes,
left-sided heart failure. This backward pressure of the lung and put the lung, the pulmonary artery to elevate the
yes, the
pressure in the
pressures.
inside the pulmonary artery. So this a complicated case, but is actually a nice case.
Totally agree with you. Yes, it's nice case. This is the net result of this case. Nice high yield topic in the exam. Okay, let's go to my case. To you, you have Mrs. Lisa.
دكتور
Mrs.
معلش دكتور
Yes,
باسم
yes, sure.
أنا دكتور نسيبة.
Welcome, Dr. Saiba. I called you many times in the start.
Yeah, I from the start here, but when go is you are already start. I can take second case or already posted.
No, you can do the communication. It's okay for you. I will give you a communication. Okay?
Okay,
Because I should give Dr. Hassanin a case. Because he gave me a case, I
okay.
should give him a case. So tomorrow, I promise I give you, but please attend on time, okay? Because we're starting
Because I
10:30
am
and
duty, I am evening duty.
okay. I'm sorry.
I am
Wallah, I
evening
called you,
duty.
Wallah.
Yeah, I
Sorry,
am
Dr.
evening
Nusayb. I
duty.
called you. Okay,
Sometimes
tomorrow
I
I
have
promise I'll
patient I
give you.
cannot attend. Okay.
Okay, thanks. Appreciated. Okay, Dr. Hassanin, Mrs. Lisa,
Okay.
30 years. I'm writing in the chat box.
Okay.
Came with complaint of loose motion.
Is a long
Yeah, young lady, Mrs. Lisa.
Yes.
30 years, complain of loose motion.
Okay. It is يعني a consultation case, not يعني
ل- ل-
communication.
yeah, long clinical
Okay,
consultation.
okay.
I'll give you 2 minutes, then we'll start. You ready?
Okay, I'm ready.
Okay, here you go.
Hello,
Hello.
I am Dr. Hassanin. I am the treating doctor today. You are Miss Lisa, 30 years
Yes.
old.
Yeah, I am.
Nice to meet you, Miss Lisa. Miss Lisa, could you tell me more about? Actually, Miss Lisa, I read the referral letter from your GB mentioning that you have loose motion. Could you tell me more about this?
Yeah, doctor, I'm suffering from this loose motion for long time now. I don't find any treatment for my condition. Can you help me with this?
For يعني how long you
Yeah, it's around now 6 months, doctor. I
around
tried a lot.
6 months?
Yeah,
Mhm.
yeah, I tried a lot of medication, but it didn't help.
It start gradually or suddenly?
Yeah, it was gradually, and
How did Mhm.
yeah, it's worsening now.
Mhm. How did it affect your daily activity?
Yeah, doctor, I am going to the washroom every now and then. I feel difficult to cope with this.
Mhm. It is a particular time you may feel this may pass this loose motion in the morning or in the
No,
night.
no, it's not related. Maybe no relation, doctor, actually.
Mhm. Mhm. Uh, are there is يعني anything will exacerbate this loose motion?
Uh, like what, doctor?
Okay. Any relieving factor?
I didn't notice, doctor. It's there, always there.
Mhm. Okay. So You how many times go to the water cycle?
Yeah, doctor, I'm going around 4, sometimes 5. Yeah,
Okay.
some days
What is
I went 6 times.
okay? Okay. Uh, can you tell me about the amount of your stool?
Yeah, it's like uh, watery one, and it's a large amount. Yeah,
Okay. Is fatty or difficult to flush?
no, it's
Okay.
flushable one.
Okay. Okay. Blood. Are you notice blood in the your stool?
Doctor, yes, it wasn't there, but I was wondering why there is blood in my stool recently for the last week.
Mhm. Okay. Uh, okay. I am sorry for that. So, do you have a high temperature?
No,
Do you feel there is lump on pump in your body?
no.
Do you have fatigue?
Yes, doctor, I feel some tiredness.
Okay. Okay. Do you have weight loss?
And yeah, a little bit, doctor. I lost around 3 kilograms for the last 6 months.
You lose it intentionally.
No, at all, doctor.
Mhm. Not intentional. Okay.
Yes,
Uh, okay. So, do you vomit blood?
no, doctor, never.
Do you have a vomiting anymore?
No,
Do you have abdominal pain?
yes, doctor, I have this
Where the site of the abdominal pain?
all over, doctor, my tummy. No particular
Okay.
area, no particular place, all over.
Okay. Do you have ulcer in your mouth?
No, doctor,
Do you experience hair loss?
no.
Any joint pain?
Sometimes, doctor, yes, I feel some joint pain.
Where the site of the joint pain?
It's not particular joint. Sometimes in my legs, sometimes in my hand. No particular one.
In the back. Are there joint pain in the back?
Sometimes I feel yes back pain, doctor, but it's not like the knees and hands.
Okay. Did you have skin rash or skin ulcers?
Yeah, doctor, I notice a rash in my foot, and it's also bothering me, doctor. It appears the last 2 weeks. I guess it's bigger in size now.
Mhm. It is about the rash. It is firstly appear as a small boil, and
Yes,
then open up.
yes, you're right, doctor.
Okay, okay. So I would like to ask you other questions if you don't mind. Uh, do you have shortness of breath?
No.
Do you have palpitation?
Awareness of my heartbeat. Yes, I
Yes,
aware
yes,
my yeah, I
yes,
sometimes I
yes.
feel my heartbeat, yes.
Okay. Do you have chest pain?
No.
Do you have any problem in your waterworks?
Uh Sometimes, doctor, when I have this loose motion, especially if it's more frequent, I notice my water work being less.
Mm-hmm. Mm-hmm. Okay. Do you have any problem in your eyes, such as blurred vision?
No,
Any redness in your eye?
no,
Okay. Painful in your eye?
no.
Okay. Uh, Okay. Do you have? I would like to ask you, do you prefer cold weather or hot weather?
Both are equal for me, though.
Okay. Okay. What's about? Do you have any? Do you have any dizziness from the standing position? Dizziness.
Uh, Actually, doctor, I feel it, especially when I stand from the sitting position. Yes, you're right.
Okay. Do you have headache?
No,
Do you have any abnormal body movement?
no, no,
Do you have any numbness in your
no,
limbs? Do you have any weakness in your limbs?
no.
About your memory, it's normal or not?
Yeah, yeah, doctor. I'm okay.
Okay. Uh, in returning to your loose motion, is there any incontinence you feel you are hurried to go to the WC?
Yes,
Urgency? Yes.
yeah, but I feel because of it's more watery, I run to the wash, but I control it well, doctor. It's not affected the
Oh,
control.
okay. Okay. Do you have any family history in your family suffer from
Yeah,
like this
doctor.
condition?
My mother always having what's called irritable bowel syndrome.
Okay. Do you have surgery, previous surgery?
No, doctor.
Do you have drug allergy?
No,
Do you have a previous blood transfusion?
no,
Do you have a previous admission to the hospital?
no.
Uh, are you on any medication?
Uh, I told you before about some medication for this loose motion. I
Mm,
took some fibers. My
mm.
friend told me that it might help for this loose motion.
Okay. Uh, do you have any chronic condition, DM or hypertension or other?
No, no high blood pressure, no high blood sugar.
Okay. What's I would like to ask you about your mood. What is about your mood?
I'm okay, doctor. Just worried about this loose motion
Okay.
and why it's worsening. Yeah, that's it.
Okay. Do you travel recently
Yes, doctor. I just came from Thailand.
from Thailand? Uh, how many days you stay in Thailand?
A week?
A week. Where is the area in the Thailand? In the beach or
Yeah,
in the?
yes, in the hotel, and yes, there was a beach as well.
Okay. Actually, do you have a jaundice or يعني لو وش a discoloration in your eyes?
No,
Okay. I would like to ask you some private question if you don't mind.
yes.
Do you have any casual sexual relationship in your travel?
Yeah, doctor. Yes, I have.
What is the type of the partner? Homosexual or heterosexual?
Yeah, doctor. It doesn't matter. Anyway, it was protected one.
Protected one. Okay.
Yes,
Uh, okay. Okay. Would you like to examine you? I would like to examine. Is
sure,
that okay with you?
sure.
Okay.
Yeah, sure.
Firstly, I will start from the vital sign A, B, C, D, E regarding pulse
Yes.
rate, blood pressure.
Yeah,
Okay.
yeah. Blood pressure borderline 100/70, pulse rate 100, and temperature is normal 37.5.
Okay. I would like to check blood pressure on a standing position.
It's around 90/60 after standing.
Okay. I would like to examine the patient from the hands. I would like to seek for leukonychia, koilonychia. I would like to seek to the pallor of the palm.
Yeah,
Also,
some pallor. Yeah, some
okay.
pallor and some colonoscopy.
Okay, I would like to seek to the pallor and the conjunctiva and the jaundice on the conjunctiva.
Sorry, leukoplakia, not colonoscopy. Leukoplakia. Pallor, yes, there
Yes,
is pallor. Yeah, what
okay.
else?
There is pallor. There, I would like also to examine the JVB and the capillary
No.
ruffle and the skin
Excellent.
tergum.
Yeah,
And
capillary refill, yes, is delayed little bit, but still 2 seconds.
okay, I would like to examine the mouth for mucous membrane wetting and
Yeah,
examine the mouth for the
excellent.
mouth ulcer.
Yeah, no ulcers, but there is some dryness.
Okay, I would like to examine the abdomen. I would like to palpate the liver. Actually, I would like to make superficial and deep palpation.
Excellent. There is generalized tendons all over the body, all over the tummy. 2 minutes
No
remaining.
mass. Okay,
No
no
mass.
mass.
No
No
mass,
mass.
yes.
Okay, I would like to examine the liver and the palpate the liver and palpate the spleen.
No hepatomegaly, no splenomegaly.
Okay, and the inspection of the abdomen, there is nothing previously. Okay.
No scar.
Okay, I would like to examine the ulcer in the leg. What is the characteristic of the ulcer?
Yes, so 1
Macule,
minute
palpule.
remaining. Yes, I will show you the rash. If you asked me earlier, I could show you. Okay, go ahead. What else you want to do until we see? Yes, this is the rash. Oh my God, that's appear. Okay, and yes, this is the rash. Okay, you can see.
Okay, okay, I see it.
What
Okay.
you want to examine the rash else?
Okay. Also, I would like to examine the lymph node, the inguinal lymph node.
No need. The examiner said, and the 30-second remains.
Then, okay, I would like to examine also the genitalia. What is your concern, Miss Lisa?
What I have, doctor, is it like my mom, irritable bowel syndrome?
Actually, it is a good question, Miss Lisa. Your condition may vary from the simple bowel infection to the what is called the inflammatory bowel disease. Specifically, it's called ulcerative colitis, which is condition lead to the ulceration in the lining of your large bowel, and these make you feel like this blood loose stool and the joint pain and this tiredness and this sign of pallorness. So what we do now it is to we will order some blood test and stool test, and we will do a camera test inside your bowel, and I will arrange a next appointment to talk more about the camera test. In general, you will lie on the left side, and there is local anesthesia and some sedations, and we will put the camera in your large bowel, and we will see
Okay,
if there
time
is
is up.
anything, and we will
Okay, time is
take
up.
a tissue. Okay, thank you.
Okay, I'll add one more concern, then you can answer me. Yes.
Okay.
Is it, doctor, is it related to my travel, this
Okay, it
loose
is
motion?
actually it's might be related to your travel, but till now we will need to search for any causes that may cause the
Okay.
symptoms.
Okay, thank you, doctor. So
Thank you.
time is up. Let's go to the presentation. Present your case, please.
Okay, I would like to present this lady who complained from loose stool for about 6 months with the blood in the stool, and she has palpitations and pallorness, and she has joint pain and multiple joints. Also, she has a travel to the Thailand, I think for 1 week, and there is also a casual relationship a casual sexual relationship with protected measures. The important negative is there is no a significant drug history. There is no surgery. There is no lump on bum or weight loss or fever. Also, there is no family history apart from irritable bowel syndrome in her mother. An examination.
Yeah.
Okay.
So before examination, doctor, give me differential diagnosis.
Okay, the differential diagnosis according to this history, it varies from the inflammatory bowel disease, Crohn's disease, ulcerative colitis or Crohn's disease, and it may relate to the celiac disease. Number 3. Number 4, it may be related to the tropical seabrew because of there is a travel history to the tropic area in the Thailand. And I would like also to make a sexual transmitted disease in the rectum, infection in the rectum because of the there is a casual sexual relationship in the Thailand.
Okay. So give me the investigation first, then the management plan.
The investigations.
Yeah, how to investigate this patient.
Okay. I would like to order a simple blood test for infectious screen, CBC for looking for white PC, and ESR and C-reactive protein if it is elevated, which is indicating infection. Also, I would like to order fecal calprotectin, and I would like to order celiac screen anti-TTG, anti-endomysial antibody. Also, I would like to order a stool examination, a general stool examination if there is any infections with specific parasites and with special staining. I would like to order a stool culture and blood culture. Besides the metabolic panel regarding renal function test and serum electrolytes, if it is hypokalemia because of the diarrhea. Also, I would like to examine. Also, I would like to order endoscopy, lower endoscopy for these patients. Also, I would like. Also, I may order a special X-ray for the hand or for the back.
Yeah. What about the lesion in the leg?
Okay. Regarding the lesion in the leg, it is suggestive of biodermic endoryosum. Also, I would like to take biopsy, a tissue biopsy from this lesion.
Yeah. Okay. How to manage this patient?
Actually, I will manage these patients with non-pharmacological measure like MDT, including gastroenterologist, internal medicines, and dermatologist, and also patient counseling, patient education, patient vaccinations, and avoid the smoking. Okay. And regarding the medications, I would like to begin with acute management if there is any sign of hypotension with IV normal saline or IV hydrocortisones. And if there is no response, also I would ask for abdomen X-ray if there is dilatation in the colon, and I will make titrate the medication to the immunological and biological therapy. And the surgery may be last line if there is toxic megacolon, not response to the medications. In the long term, I will put the patients on oral steroids to calm down this inflammatory process of ulcerative colitis.
Yeah. So induction and maintaining the
And
remission.
remission, yes.
Yeah.
And induction
Yes.
and maintaining remission.
Maintaining the remission. Yes. Excellent.
Yes. According to the diagnosis. Yes.
According to diagnosis. Yes. Yeah. What else? Yeah, at the time I actually was not going, so we started the time late. What possible complication and sorry, what the curable management of ulcerative colitis? The curable
The curable management is
treatments.
acoloctin.
Excellent. Yes. In one word. Yes.
Yes, pancreas.
Okay. Yeah. Okay. Great, Dr. Hassanin. So the timer was ongoing and wasn't going, and we didn't detect the timer, but you managed the case and you investigate, you did everything. So let's go to the comment. I'll start
Yes.
from,
Yes.
yeah. So you did great. You reached the diagnosis, but there is some missed point, and I want you to learn
Yes.
from
Yes.
this message. Okay. So let's start from the beginning. The loose motion analysis. So you analyze the onset, course, duration, the timing, the amount, the blood. All this was great and related to the case. When you have positive blood, so it's mostly inflammatory bowel disease. Then you should rule out, even you ask for the flushability, but you should ask for the celiac because celiac is very important and very common there. The relation to the food and the smell offensive, and it contains slime. You ask for the fat or the slime and the flushability. I denied that, but you should ask also about the celiac. Apart from this, you should ask question awaking you from sleep because it will be diagnostic for serious diarrhea, not irritable bowel syndrome.
Yes, not
So
functional.
irritable bowel syndrome, it will not awake me and it will be alternating with. You can add this question. Do you have any stress? Just rule out irritable bowel syndrome, and you can put it in the
Yes.
differential as the patient mother was diagnosed with this. So it's important to roll out the the irritable bowel syndrome and celiac disease from the beginning. Okay, let's leave the complaint and we'll go to the GI system. You ask well about the vomiting, blood, but you should ask in simple way, which is throwing up, feeling sick, abdominal tummy pain, the soreness in the mouth. It was a great question. Just to to conclude or troll in the Crohn's or troll out Crohn's. So if no sores means it's ulcerative. If there is sores, you can think about Crohn's. And the celiac as well, it can cause sores, mouth sores. Then you ask not in disorganized way, but you ask some time for the CNS up and down. You went for the eye and vision, then you went for another system, then back to the CNS for the headache and
Yes.
the weakness
Yes.
and numbness. Yeah.
Yes. Yes.
So
Yes.
try
Yes.
to make every system separate, just to be systemized and organized way.
Yes. Yes.
The urinary as well, and I told you there is darkening of my water work and the amount being less sometimes if the loose motion being more.
Yes.
Endocrine, you ask for the weather, it's good. Chest pain, the awareness of heartbeat, yes, I give you. And chest, you didn't ask for short, no, you asked for short of breath. The constitutional symptoms, you ask it in good way,
Oh.
temperature, the lumps
Yes.
or bumps, tiredness, the weight, and you told me unintentional, yes, unintentional, but you didn't ask about the appetite. You should ask about appetite. It's important in some diseases, but it's okay here because the patient maybe in good appetite and yeah, the loss of weight here is due to the diarrhea, but the appetite might not be affected. And in contrast to the cancer, the appetite will be impaired and that the weight as well. The dizziness was related to the anemia. You ask it. It's standing from sitting. It's important. The skin rash from the start, if you want, you can tell me, show me the skin rash.
Mhm.
Okay. The joint pain, yes, great question. For the extra what's called GI symptoms.
Extra axial. Yes.
Yeah.
Axial. Yes. Axial and
No,
peripheral.
no, I mean extra gastroenterology. I mean,
Okay.
yeah,
Yes, بالضبط. Yes. Okay.
yeah. Okay, so it's yeah, there is some
Extra
association joint pain.
intestinal.
Yeah, extra-intestinal. Yeah,
Intestinal.
thank you for correction. Yes, extra-intestinal. Then you can also add to the extra-intestinal. What else in this patient? The joint
I
we
ask
mentioned.
about
The eyes.
I
Yeah,
ask
you ask
about
for the eyes. Yeah, the
eyes,
eyes you ask.
eyes, peripheral, and axial,
And
joint pain,
the
peripheral,
skin.
axial, and
The skin.
yes,
Yeah.
the skin
And there
and
is
the eyes.
also
Yes,
yeah, there is also association with the ulcerative colitis, which is especially in the skin itching. If the patient has skin itching, what do you think? Ulcerative colitis
itching
and
in the
itching,
skin.
tummy
Also,
pain,
also,
yes, hypochondrial pain, right, hypochondrial pain,
Primary
sclerosing,
sclerosis.
sclerosing cholangitis, yes,
yes,
sclerosing
yes.
cholangitis. There's association, okay?
No,
Then,
okay.
yeah, a good question about the blood. Blood, did you cough blood or? But you didn't ask me the amount of blood in the back passage. You should ask, okay? It's important just to know the amount. It might be severe and patient will be severely anemic, okay,
Yes,
for the welfare. Although you will discover that in the examination. Okay, let's go. Another question, very important. Are you using any medication? Add to them any blood thinning medication, any blood from any other orifice. Because if you have bleeding from anywhere, you should ask about bleeding from other orifice, might be systemic disease. Okay,
yes,
this is an important one. The family history, I give you irritable bowel syndrome. Travel history, very important here. You ask me well about where I stayed, but you didn't ask me what's the nature of your food, which is very important in this patient. Did I
yes. Because
eat
not
from
have,
the yeah
I don't have time. Yes, yes. It's very important. Yes,
yeah? But you ask about the beach. So what's the benefit of asking about the beach? The best question here about the food, or the important question here about the food. You should ask me from where did you eat your food, from local restaurant or from the hotel. It's very important. Anyone in your group has any
yes,
problem with the loose motion? Did you notice the loose motion after coming back being more, yeah, the frequency? So I might think about gastroenteritis only from the travel history. And I give you travel history just to distract you, but in the same way to put it in the differential. It's very important, okay? Then the
understood.
medical history asked me about the admission, excellent, the allergy, the surgery, the medication, very important. For the HIV, it's okay, you can ask all the question. The piercing, tattooing, recreational drug, blood transfusion, casual relationships. But I don't prefer to ask me what the nature of, if I suspect the HIV only, I can ask this question. But there is no HIV in this patient. It's clear that the patient is having ulcerative colitis or inflammatory bowel disease. Or at least ask, did you have protected sex? Don't ask about the nature of the relationship with whom or with what type of the relationship. Okay, better not to mention. Just your role here is to use protected sex, not to prevent from homo or hetero. Okay, in bases they are, it's in our religion, yeah, but it's they're not like that, so it's not
I
relevant.
think
I mean, yeah.
I think in the OST,
Mhm.
yeah, they said when you reach the يعني sexual history,
Uh-huh.
you should ask about the type of the intercourse. العفو, I'm sorry, the route of the intercourse, oral or
Uh,
anal or
no,
vaginal. This is number one.
yeah,
Hey, okay,
I,
okay. This is number one.
I
Number two.
disagree for this question. Okay, go ahead. Okay, what else?
Okay, okay. I just said about the OST, and they said you should ask about the type of the partner, the orientation of you and the
Okay,
partner.
you can go deep,
Homosexual.
more deep in HIV or any sexual transmitted disease, but in this patient, it's clear. And if you want to roll out, just ask for any protected or any casual relationships. If I said yes, ask me, is it protected? And no
Uh,
only. No need to go
actually,
deep.
because I have an important differential in like this scenario. I
No,
think
but
it is called
yeah, I agree.
lympho. Yes.
Granuloma,
STI.
yeah.
Yes,
Yeah.
STI, which infect the rectum and gives the picture of ulcerative colitis. And even when we do a colonoscopy, we found ulceration in the rectum and the most distal part of the sigmoid colon, which
But
is
it's
at
not common. Yes, but it's not common differential.
okay.
Yeah.
It is not common. Yes. Okay. I I I was afraid from this يعني diagnosis or differential.
It's okay, but okay.
Mm.
As you wish, but this is
Yeah.
my advice. If you
Okay.
have like this, yeah, you can ask only superficial question, not deep question. Anyway, let's go to
Okay.
the system you miss, the female system in this patient. I mean the abortion, the periods, and any miscarriage or whatever. Maybe it's irrelevant, but you
تفضل.
can ask them.
Yes.
Yeah,
Yes. Mm.
okay. Let's go to the social. You miss all the social you miss. The smoking, the alcohol, the job, you miss all. Okay. Try to write the skeleton in the paper in order not to miss any of this history and social
Actually,
or occupational.
yes. Actually, the social, I ask only about the travel history. Yes, because I didn't
Yeah,
have time to answer to ask about all these.
yeah. Okay. The examination, you did it great. The vitals, starting from vitals, palm, signs of anemia either in the hand or in the pulse, in the vitals, in the face, jaundice, pallor. Dryness, very important in this patient, the dryness. And I prefer to ask how you are compensating for that. Did you
Mm.
drink more water to compensate? Yeah, it's very
Yes.
important question. Just roll out
Yes,
the
patient welfare.
dehydration sign. The mucous membrane you checked, very important. Yeah, it was great as well. The other examination downward to the abdomen, you ask for the any scars, inspection, superficial palpation, deep palpation, any hepatomegaly, it wasn't there. Then you examined the skin rash, it was pyoderma gangrenosum, but you should ask more. Is there any pain, any oozing, any discharge, the sensation over it, and the temperature on and before and after, I mean, sorry, above and below. It's important as well. Okay, this for any rash, not only
Yes.
by dermatologist.
Pain,
Just
itching, yes. Pain, itching,
yeah,
rash, oozing, yes.
yes, sensation over.
And the beginning of the
Yeah,
rash. Actually, I ask you about the nature of the beginning of the rash. You
yeah,
said it
yeah.
is
You ask them
appeared
as a
as a
package.
boil, yes, and
Yeah,
then open up and ulcerate. It's I catch the
yeah.
biodermal gangrenosum from your description.
Okay.
Okay.
That's it. You did great. You reached the diagnosis. So our differential in this patient, the question for relation to the food, Dr. Hassan, and I didn't mention for the food to roll out celiac, pasta, and bread. You should ask as well. Okay,
Yes.
so
Very
our
important.
differential, yeah,
Mm.
our differential in this patient will be inflammatory bowel disease in either Crohn's and mostly ulcerative colitis because it's more bloody and mainly in the colon. Then the second differential will be traveler diarrhea because this the patient just came, whatever the kind, what amoeba, E. coli, or sorry, either traveler E. coli or any other gastroenteritis due to amoeba or Gambiasis or whatever the infection, gastroenteritis.
Actually,
Then celiac.
yes. Celiac. Yes. Celiac.
Yeah, and you can put also irritable bowel, but again, it's irritable bowel. The patient awake from not no stress, and it awake him or her from sleep. This is our disease. Yes, Dr. Muhammad, thank you. Okay,
جر...
the
okay
management.
يعني I'm sorry regarding the يعني travel diarrhea. The traveler diarrhea, I think the most common is a Campylobacter jejuni because there is a bloody diarrhea.
Bloody one, yes,
The
bloody
ja-
one, yes, you're right.
Yes, yes.
Yes. Campylobacter
Yes,
and what
typhoid,
else? Shigella,
Campylobacter, shigellosis.
Shigella,
Shigellosis is actually
yes.
acute, يعني very acute. And this
Mhm.
patient, he has no fever. The giardiasis, there is no يعني flushing of the diarrhea, flashability, and there is no a bloody in the stool. Must be in the giardiasis, I think.
And this, I guess, related to the milk.
Yes, it is caused a
Intolerance.
lactose intolerance.
Yeah, it is intolerance, yes.
Thank you.
Okay, so this is the case. I guess the topic is clear about inflammatory bowel disease. Sorry, inflammatory bowel disease. Yes. Let's start from the investigation. As any disease, we will start by CBC. I mean, general investigation: CBC, electrolyte, kidney function, liver function. This is in general, and very important to tell the exam. I want to check for anemia. And what type of anemia. It's very important in this patient. Coagulation profile as well, and specific for the disease. What you think specific for the disease? You said uh, what's called calprotectin. Yes, calprotectin. Fecal calprotectin. It's
Yes,
important.
fecal calprotectin for ulcerative
Yes.
for all inflammatory bowel disease, and
Yeah,
ACH
and there
for
is
celiac screen. Yes.
celiac screening. Okay, but what's specific for ulcerative colitis as antibodies?
Ulcerative colitis antibody, I think طلع الشيطان
P-ANCA.
البي ان
Okay.
كيس
Yes, P-ANCA.
يس والكرون ديزيز الانتي سيرفيشن انتبودي كرونز
For Crohn's anti-ASCA. ASCA. Okay.
I think it's called anti سيرفيشيا. Okay.
Yeah,
Okay.
ASCA. The abbreviation is ASCA.
ASCA. Yes, ASCA. Yes.
I'm not sure
ASCA.
about the full name, but it's ASCA. Okay. This is for
Yes,
the
it's ASCA.
laboratory.
Yes.
And don't forget the inflammatory marker, ASR, CRP. Okay. The diagnostic one will be colonoscopy. And the diagnostic features of ulcerative colitis in the colonoscopy. Ulcers
Yes.
with the only superficial layers.
With continuation,
Yes.
without skip lesions.
Yeah, without skip lesion, yes. Then
The stool,
for the
stool
complication,
culture. Yes,
yes,
stool
very
culture and
important.
stool
Yes, you're right.
is very
So, yeah,
important.
but
It is very
yes, you're
very
right.
important, and I mentioned it. Stool
Yes,
culture and
you
stool
did it.
examination. Yes.
Yes, you did it. Okay. Complication, you could think about ultrasound liver rule out any association with
Biliary
ulcerative
system.
colitis. Yeah. There is also
RCB.
screening
I
for
need
ulcerative
RCB.
colitis. Screening for yes, ARCB for this sclerosing cholangitis. Screening, is there any complication with the cancer with ulcerative colitis? Is there
Yes.
any, I mean, cancer colon? There is any possibility?
Yes. After and 10 days of the diagnosis. العفو after 10
After years, yes.
years.
So
10 years of
yes,
the diagnosis.
so there is, you can put screening this patient under the screening program.
It is very important. Yes.
Yeah. The management plan, multidisciplinary team approach, and as you said, ABC for the acute presentation. If the patient is dehydrated, good hydration and replacement of the electrolyte. If the patient is having any electrolyte disturbance, he might have a hyponatremia, hypokalemia, or any electrolyte hypomagnesemia as well, hypocalcemia.
Yes.
For the induction of management, this is for multi-senior team, and for the non-pharmacological education counseling about the disease and the complication association and the red flags, very important in this patient. If there is a case of frequency of diarrhea, it's very important to seek medical advice.
Yes.
And yeah, also if there is severe tummy pain or abdominal pain for any complication like toxic megacolon, it's very important.
Regarding the
Okay.
patient safety, I didn't
Yeah.
say to the patient what are the nature of medication that we will give it to him. I didn't say that we will give you some intravenous medication that may help to slow down of the your overaction of your immune
Okay.
system. I think
If
it is
the
important.
patient didn't ask you, you mean if to the examiner or to the patient, because you don't have
لا to the
diagnosis yet.
patient. لا to the patient.
So the best thing is to say we will have another meeting to sit with you and to tell you about your management plan. This is the best answer. Don't go deep. You don't know the diagnosis yet.
صح.
Okay.
Okay.
So induction of therapy and maintenance of remission. As we know, steroid sometimes we are giving rectal, or no, not here, the rectal for, I guess the rectal for Crohn's, right? Rectal.
Actually, the induction therapy in the chronic state, not in the
Steroid, yes.
emergency. Yes, in the emergency state. We can give actually it's divided to the proximal or distal. The proximal mean the ascend, the transverse colon and the ascending. Here we can give enema, budesonide enema, and the distal and sigmoid colon and the rectum. We can give budesonide subsidiaries and plus minus oral budesonide or I'm sorry, aminosalicylate enema or aminosalicylate subsidiaries plus minus oral aminosalicylate. If there is no response, we can add the prednisolone or budesonide, one of the corticosteroid. This regarding ulcerative colitis.
Pharmacological, yes.
Yes.
It's a big topic of management, pharmacological management of ulcerative colitis. So the big thing is to utilize the time talking about the non-pharmacological multidisciplinary team approach and the
just
counseling
headline.
and education.
Just headline.
Yeah,
oral medication.
Headline, but but you will be in trouble if he asks about the more medication and the doses and the route. Yeah, but before the basis, of course, you'll be reading this topic and you will be more memorizing the medication more and more. So we can share it in the group just for refreshment, and we can just to refresh our knowledge. Any question, any comment in this patient? E. coli, yes, traveler, store culture and analysis, very important. Yes, we mentioned Shigella, giardiasis. Okay, so I guess all points are clear in this patient.
If I can make a summary for my pitfall or faults in the history.
Yeah.
Okay. I didn't ask about the trigger, a specific trigger like food, bread, pasta, or
relation to the food. Yes, very important.
Yes, or dairy product. If patient has a lactose intolerance, this is number one. I didn't explore the amount of the blood or the history about the blood. Yes. I didn't make a thorough history about socially. Even I take travel history. I didn't ask about actually يعني هنا
Awakening
تقريبا
from sleep. This is important. Awakening from
okay
sleep.
okay to differentiate the functional from the organic
Yes,
cause. It is very
exactly.
important. Yes, okay,
Exactly.
thank you. And regarding the examinations, I didn't examine the ulcer right way. I wait until I begin the examination.
Yes. Yeah,
Okay.
you're right. And don't forget to offer digital rectal examination. Just offer it.
Oh,
Yeah,
yeah,
for the
very
bloods.
important. Yes,
Yeah,
yes, yes,
for the
yes,
blood.
yes.
Okay.
Very, very important.
Mhm.
Yes.
Any question from others? Any comment? Okay. If no comment or no question, uh, I don't know if the time, how the time with the people now. Is it late? Because I feel the number is not that much today. You want to proceed for communication or it's enough for today? So we can, okay.
Okay, if you have a case you prepared. Actually, I didn't prepare communication.
Okay, we can do one case. You want?
Okay,
I will give
okay.
you the case of Stvn-Johonson. Someone was raised it.
Uh-huh.
I will write in,
Steven
yeah, I
Johnson.
will write Stvn-Johonson syndrome.
Okay,
Yes.
let's
So
make it.
this Mrs. Visa was delivered a baby last week. And then she had infection. Read the scenario, then we will start.
Okay. Mhm.
Mrs. Lisa, 35 years, delivered a baby last week. Then she had infection and started on penicillin. Then she developed skin rash and her condition deteriorated. Intubated, connected mechanical shifted to ICU as she's in critical condition. Diagnosed as, I didn't write, skin rash. Yes, and diagnosed as, and the diagnosis was Stvn.
The time is 10 minutes.
Yeah.
10 minutes. Okay.
Two minutes when it start.
Okay.
Ready?
Okay.
Let's share the timer. You can see the timer.
Okay. We start.
Yes.
Hello.
Hello.
I am Dr. Hassanin. I am the treating doctor today. Can I confirm your name?
Yeah, I'm Smith.
Nice to meet you, Smith. Are you the next kin of Miss
Lisa.
Lisa?
She,
Miss
yeah,
Lisa?
yeah. I am the
Okay.
one, doctor, and she's 35 years. What
Okay.
happened, doctor?
Nice to meet you, Mr. In the beginning, I would like to ask you, what do you know about your wife condition, please?
Doctor, my wife just delivered the baby and
Mhm,
she was okay, but the doctor told me that she has some infections
mhm,
and they started antibiotics
mhm,
and that's it. I don't know what happened after that. They called me and they said they need to talk with me. I don't know what happened.
mhm. Actually, Mr. Adam, your wife, Miss Lisa, was admitted for a delivery a baby, as you know, and there is a serious infection that's occurred with her. So, in the best of interest of Miss Lisa, we started her on a penicillin. And after that, she developed a skin rash, and her condition deteriorates until she is now in the ICU, intensive care units. and she is in mechanical ventilation for her lungs. I'm sorry for this news, Mr. Adam.
What do you mean by mechanical ventilation? What do you mean by critical? I don't. What you are saying, doctor? Are you talking about my wife? Are you sure, doctor?
Actually, we are sure, and I am appreciate your concern. It is normal to think, to feel like that, but actually, her condition deteriorate rapidly due to these rapid infections and some complications that occur. So she is now on the ICU, and the mechanical ventilation, as you asking me, it is help her to breathing artificially. I am sorry for this news.
Oh my God. Oh my God, doctor. Is she well, doctor? Please reassure me, doctor. Is she fine?
Actually, we try to do our best to save her life and to ensure that she is returned to her family. If you have any other concern, Mr. Adam.
Yeah, doctor. Do you think she will be okay and she will be back? Tell me,
We
doctor.
will do our best, and we hope that she will come back her power and return to her family. Actually, I would like to talk you with something. The cause of her deterioration, actually, it is due to her penicillin allergy.
What do you
Did
mean,
she
doctor?
have
So
did she have any penicillin allergy previously?
I don't know, doctor. Do you think, doctor, is it a mistake?
Actually, it is not a mistake because in her record, it is not mentioned that she has a penicillin allergy, and the penicillin is given to her. It was in her best of interest for her condition, and with all and the way it is with like other medications, there is a side effect with medications, and unfortunately, these side effects occur with your wife. But I want you to ensure that we are here to help her, and we will do our best to save her life.
Doctor, did you do the allergy test before giving this medication?
Actually, of course, we did allergy test to before giving these medications. But it
Oh
is
my
can
God,
but it is cannot predict on the medication on the test only just on the test, because it is may occur even the patients has no sign of allergy in this skin test, as the penicillin and like other drugs have what is called a synergistic side effects or not accumulative side effects. So it sometimes can be unpredictable, even with a skin allergy test.
oh my
I am
God,
sorry for
doctor.
this news. I am sorry for this news, Mr. Adam. As I said, we will do our best for her.
Oh my God, doctor. Will she die, doctor? Be honest, doctor, please tell me. Is there any possibility to survive?
The condition of your wife, unfortunately, it is not stable right now. Uh, uh, at this stage, we cannot predict the course of the conditions. As I said, we are here as a team of multiple specialties and multiple experienced doctors, and we are all try to do our best to save her life, and we will hope she will return to you with a healthier condition.
I hope so, doctor. Please do your best, doctor. Her baby need hair.
I appreciate your concern, and it is normally to feel like these hard situations. Uh, uh, Mr. Adam, if you don't mind, I would like to ask you some question, please.
Yeah, sure, doctor.
Uh, what's about your about her baby? It's her baby. What's about the milk of her baby? Uh, what do you about this?
Yeah, doctor. My baby in the hospital, in his room, and they are feeding him with this artificial
Mhm,
milk.
mhm.
I feel
We
so
can
I feel worried about him,
mhm,
doctor, as well.
mhm. We can arrange a special nurse which who can help you with the feeding of the baby and for a healthy condition of your baby. Okay.
Sure, doctor. Sure. Yes.
Okay. Do you have another concern, Mr. Adam?
Yeah, doctor. I want to
Okay.
complain, doctor, about this. Who gave her this medication?
Actually, I cannot give you names about the situation because here we are all the team working together. And as I said, the complication occurs even with optimum condition and with optimum healthcare provided to the patients. Uh, uh, and in the same time, you have right to make a complaint, and I will direct you to the services of the complaints in the hospital, and you can make complaints.
Okay, doctor. Just guide me to them, doctor, please.
I will guide you to the office services
Okay.
of the complaints.
Thank you, doctor. Thank you.
Thank you. Mr. Adam, I would like to ask for you a Uber taxi to help you guide you to the house. Is that okay?
Doctor, I can't leave, doctor. I feel so worried about my wife,
Okay.
and
Okay.
I am dependent on her. She is the one that's helping me at home, and she's the one doing everything at home. I
I am
can't go
sorry for
home with
this
her
news.
alone. Yeah.
Okay, okay, uh, okay. I am sorry for this news, and we will take care about her condition, and I will arrange the specialist nursing of feeding babies for your baby. Thank you very much.
Okay, thank you, doctor. Time is up. Yes, yes, now. Okay, let's great,
Do bad.
Dr.
I
Salit.
do bad.
Yeah,
Okay,
no, no,
I
it's
do
okay. You
bad.
did it. No, no, no. At least you address all concerns, okay? And
Okay.
this is first scenario with me. So I will just comment, and you will learn from the comments, okay? And the comment for all, not only about your performance. You did great performance, by the way. Just to teach all, this is the scenario. So let's start from the beginning. Introduction. You introduce yourself. Who are you? And are you Mr. I wrote here Adam, but yeah, Adam. Yeah. And you didn't remember the name anyway. You asked me what's your name, and you are the next of kin. Yes, you asked me for the next of kin, and confirm the data of the patient, Mrs. Lisa. She's 35. Then you ask good question. What do you know so far about Mrs. Lisa condition? Yeah, and I told you what happened. I was there, and she was delivered, and so on. Then ask me after that the expectation. What's your expectation about this meeting? You didn't ask about the expectation. It's very important, okay? This is a missing point.
Mhm,
So I'm just not
mhm,
commenting on you or for the all. I mean, I'm just giving the comment as a feedback and to help others to learn how to do it, okay? Then after that, before asking the expectation, you should ask about the expectation. Then after that, you start to explain everything, and it was just complicated words. You told me that she had an infection and she started on the penicillin and she developed skin rash. You didn't even mention what the diagnosis. It was there, Stvn-Johonson syndrome, and it's one of the complications related to the antibug, yeah, antibug which she received for the best interest for her condition, which is infection, and the infection following the delivery, they are treating according to the guidelines with this antibiotics or antibug. So the question, then you told me about the deterioration about the condition connection to mechanical ventilation. I don't know what's all this drama. You should give me as pieces, not all in one shot, okay? The mechanical ventilation is jargon, so you can say, as you said, breathing machine or supporting the machine of your breathing or your wife breathing, as you explain later, but it should be from the start. Don't wait for me to ask you what is the machine or what is the mechanical ventilation. I kept asking you, is she fine? If she's well, you should address my concern. No, I appreciate your worry. I can see your worry, Mr. Adam, but I'm sorry. I'm afraid to say she is not fine and her condition is not good and her condition is critical. That's why we transferred her to critical unit, and this unit for the critical patients. Okay,
I
then
said it is not stable.
yeah, unstable. Okay,
Mhm.
then the point of side effect. Yeah, it's one of the complication or unwanted effect of the medication. However, the medication was in the best of interest. Then
Yes.
the allergy. Don't guarantee about something which is not written in the scenario. I asked you, did you do the allergy test? You said yes, and you were sure about that. As long
Mhm.
as nothing written about that in the scenario, don't say it. Don't invent. Don't say something is not written in the scenario. It's
Mhm.
against you, okay?
Mhm.
So what do you know? If I said I ask this question and you don't know this, doctor, did you do allergy test for her? If you are not sure, tell me I'm not sure and I will review the file and the record and I will be back to update you. But in the real, we are not doing this. This is the other point. The allergy test for penicillin is not anymore dying. Okay, no one doing that.
Mhm.
It's obsolete now. No allergy test for penicillin. So if you are not sure, you can say I will review her file or record. If you are sure, if not written in the scenario, you can say what I'm saying. It's not anymore happen or not anymore done for the patient. We give the penicillin without doing this tests. Okay.
Mhm.
Then about the the baby. Yes, it was good when I am the one raised that, but you should ask from your side. Mr. Adam, can I ask you about your baby? How is the baby? How is doing? How is he doing now? Is he fine?
Mhm.
Does he need? Who's taking care of him? Who's looking after him? Okay.
Mhm.
Then you give me some what you said synergetic some I don't know what was that synergetic effect of the medication and so on. Don't be complicated for explaining the things. Be
Yes.
simple, even while explaining, be simple. Don't mention things in medical way as jargon, and don't do something which is very complicated and he will not understand it. Okay?
Yes.
Okay. Then who I want to complain, who give her this medication? Don't tell me I will not give you a name. Don't say that. You can say instead, uh, I'm sorry, we are a team. We are dealing with the patient as a team. No specific person or no specific uh, carer who can take care of this, and no one take decision. We are taking decision as a team. We are here
As
as
a
a
team.
teamwork. Yeah,
Mm.
I can't give you any. Don't tell me in the first. I can't give. I will not give you a name. Okay, just mention to me that we are a team and we are dealing with the patient here as a team. I want to complain. You address this well. Yes, I can guide you to the office, and the office responsible for that called patient advice liaison services. They will help you in this regards. Uh, I ask you, I'm dependent. You offer me to leave the hospital and to send me home. Why? I don't want. I want to stay with my wife. So
Mhm.
you can instead ask me in the social, some social. Do you need any support? Who's dependent on her? You have any other kids? Maybe there is also other kid at home and he need her support. So better to
Yes.
ask me who is dependent on Mrs. Lisa. Do anyone need or does anyone need any support? We can provide that support to him or to her, and that's it. You have any concern? Okay, and we can arrange another meeting for you to update you about Mrs. Lisa condition. You can't ask here about social, only the support, but no need for the smoking and whatever, the alcohol. This
Yes.
is the way how to do, and you did it great at the first time practice with me. It was great, Dr. Hassanin. Both cases you did great, the communication and the long. I hope all also get benefit from this scenario. Okay, let's read the comment. Sorry,
Basim.
Doctor. Yes,
Yes, I have one question.
yes,
This
sure.
communication
Dr.
scenario
Rabia.
is like a medical error or what? Because he's saying sorry. Sorry for what, Yani?
Sorry for his wife. Sorry for his condition, for her condition. It's
Not
not
apologize.
apologize.
Not
Yeah.
apologize.
Yes, Yani, it's just like sorry for the condition, not
Yeah.
because we are
Yes,
not sure whether
exactly.
the test dose was given or not. Tamam, we were not there at that time, okay? Because it's not mentioned in the scenario, okay? So for us, we can say that we will look into that matter, but for us, we are not sure whether the test dose was given or not. So we'll try to avoid this confrontation and move from the test dose because nothing is written here about the test dose.
Test dose, yeah, that's why I told him don't tell about test dose. It's not done anymore, Dr. Rabia. No more
Mhm.
test dose or allergy test for penicillin. They are
Okay,
not doing it anymore, okay?
tamam.
Yeah, so that's why when I asked him, did you do the test? He said, yes, I told him this is wrong. Don't say that. If not written, as you said, Dr. Rabia, if
Mhm.
something not written, don't say it, or at least tell him I will update you after reviewing her records.
Mhm.
Okay? It was great to say this, to raise up this issue when you said, yeah, the test does. So I will go back to her records and I will update you about that. Thanks, Dr. Rabia. Dr. Momina,
How are you, Dr. Basim? How are you, everyone?
welcome back. How
Welcome.
are you? How
I'm
was your
fine.
exam?
I don't know. Actually,
Okay.
actually, this is my case in the exam. This is Stvn-Johonson.
Really? Wow.
Yeah,
Okay,
but
good.
it's not about breaking bad news. The husband was aware about everything. So you feel that's a surrogate in this center. They have no reaction. They know everything, so you don't know what to tell them. And actually, they have no concern. Nothing. You only repeat the explanation of the disease many times. I don't know what to say. It's not about the breaking bad news, and they tell that the baby is okay and everything mentioned in the scenario.
Yes,
Yeah.
but you should ask. even mentioned the scenario. You should
Yeah,
talk
I
this.
asked him what you know. He said that she deteriorating and she went to ICU. All the information he know.
Even you can ask him. You want me to explain more? You want me to address anything else you want?
Yes,
Just
yes, sure. I asked him everything. I asked him what's your concern and you need
okay.
any help. Yeah.
Did
I
you
think
address the baby?
Yeah,
The baby.
regarding the baby, they mentioned in the scenario that he is good. So I inform him that your baby is good and you need any help. Like that's it.
The support, the dependence, who's dependent on the
Yeah,
wife.
I didn't focus on the support for the baby, but only I asked him if need any help or in general, and then I asked him if need any financial support like that.
So what the task? Exact task.
The task, yeah, the task only to
Angry.
explain about Stvn-Johonson, I think. Yeah,
Uh-huh.
and he asked me what you will give her, and I asked, and also the
Yeah,
explanation about the mechanical ventilation, I think, because I explained to him,
excellent.
yeah, about the mechanical ventilation.
Okay, and
But I
what you
mean,
will
Dr.
give him,
Momina,
Dr.
it's not
Momin?
like breaking bad news. It's a breaking bad news. Yani the mother has Stvn-Johonson. She's on ventilator. So it's not breaking bad news.
Yeah, because
Because
when I
doctor's
asked him what do
relative
you know,
know everything.
he explained that she deteriorating and she went to ICU, and also he explained to me that she's now breathing with machine.
Okay,
Know everything.
did they write for you? She's in coma.
Um, I cannot remember coma or no, but
Yeah, because
no, no,
ventilated.
only mentioned that she's on mechanical ventilation to support
Okay,
her breathing. That's it.
yeah, if you had time for that, you can ask for advanced. If no nothing written, advanced directive, nothing power of attorney.
Yes.
And
Yes.
yeah, the other thing also you can ask about when he told you what you will do with her, what did you say to him?
Yeah, I explained to him that we will support her breathing first. We will give her
Yeah,
medication for this immunity system and
to
for the
suppress them.
allergy and yeah,
Yeah.
hydrocortisone like that.
Did you mention the team, multidisciplinary team? We have a group of
Mm,
specialists. They will take care of her because
yeah,
you're
I
not
don't.
the one managing her only. Yeah.
Yes, yes. Maybe I didn't mention Allah. I cannot remember.
Anyway, in general, you did
Dr.
well.
Basim.
Mm,
And yes, Dr.
mm.
Hassan.
But you know the
Dr. Basim,
surrogate in the in this center they didn't يعني even the other case the stroke case when breaking bad news they will not show any reaction any يعني anything.
Yes, surrogate.
Yes.
They are
Yes.
surrogate, and mostly they are student or doctors. So
Yes.
they don't know how to act even. Okay, but in general, you did it great.
I hope
Hopefully, we will
Allah.
listen. Yeah, you will pass, inshallah, Dr. Momin.
Yeah, thank you, doctor.
Thank
Thank you
you
for
to
all
join
of
us
the
and
group.
to share.
Yeah, yeah, sure.
Thank you to share
I'm trying
us.
to join every time. Thank you, Dr. Basim.
Thank you, Dr. Momin. Yes, Dr. Hassan.
Dr. Basim, I think this case, why I not focus on the Stvn-Johonson syndrome and I didn't mention the topic for the patient. I thought that the topic of this scenario is regarding angry patient or angry the relative of the
No, he's
patient.
not angry. He's worried
But,
one, just worried.
yes, yes. This is a big mistake I fall in it. The second scenario may lie in this case, breaking bad news. I thought this is breaking bad news or not breaking bad news because the young relative know everything about the condition. So what is the main topic in
Even
this scenario?
if he knows the patient condition and ICU transfer, even he knows he might not know
Uh-huh.
what's the prognosis.
Okay.
You should
Okay.
explain the prognosis because
Okay.
you know the
Okay.
Stvn-Johonson, yeah, sometimes it's lead to multi-organ failure, and it might be his concern.
So the surprise in this scenario, when you read it in the first time, you think whether breaking bad news regarding Stvn-Johonson syndrome, or think the patient, her husband is angry because of this skin rash or because of this side effect in the first impression of the scenario. But the surprise is this: it is not breaking bad news and not angry man. I think the scenario that occur in the exam is regarding a condition counseling only, because the patient he absorbed the bad news previously, and the doctors just said that her husband it was not angry. So I think the whole story is regarding a condition counseling, and I think I will fail in this station, because I suppose that this scenario is regarding angry or breaking bad news. Not I didn't focus on the condition counseling. Okay, so I think I will fail in this station, because I didn't focus on the Stvn-Johonson syndrome as a condition. I didn't explain it.
Yeah, it's okay,
enough.
Dr. Hassanin. You did it well. You did most of the concern. You addressed most of the concern. So, and we are learning. It's not from the first time we do a scenario.
Okay, I think
so it's okay.
to all. I think they listen to all of us, because the first impression from this scenario, when I read it, I think this is angry relative, or this is breaking bad news. Okay, so I enter the station. I am afraid from the relative. But,
No. Don't be afraid. But anyway, you are going to the scenario inside the station. You don't know what you will face. So be confident, and just see what he will tell you, and you will address according to the concerns and the questions. But you did great in general.
It is nice scenario, and give us multiple lessons. This scenario.
Yeah. Thank you, Dr. Hassanin. Dr. Nusayba. Yeah, thank you. Sorry, Dr. Saiba, I gave this scenario to Dr. Hassanin because we raised it yesterday. Someone asked about it. But our rule, Dr. Nusayba, in the group, two candidates will do the case, the communication is, and the long consultation as well, long clinical consultation. Two candidates, so everyone prepare a case for the other alternatively. So I will not do a case today. I just give this case to Dr. Hassan because someone asked about it yesterday or the day before yesterday, and I promised to do the case. The second point, Dr. Hassanin didn't prepare a case. But if you want, Dr. Nusayba, you can prepare a case tomorrow, and you can receive a case from other colleagues. So let's, if no question, no comment, we can end the record, and we can take the participation tomorrow. Candidate, Dr. Rasha wrote no skin test for penicillin only or for all antibiotics. I think even for all antibiotics, no more doing this. Dr. Rasha. Okay. Let's, any question, any comment? Okay, I will end the record, then we have the nomination for tomorrow. Thank you all.
Thank you.
Thank you. Thanks, Dr. Hassanin. Nice day, nice discussion, nice cases. We'll meet you tomorrow, inshallah.
Inshallah.